Welcome to Sodexo's Expert Series, where we interview specialists from across health and care. We talk about the challenges and the solutions, with a particular focus on non-clinical support services. I'm Simon Lilly, Director of Marketing and Strategy for Sodexo Health and Care. And today we welcome Dr John Sandam. We're going to discuss clinical technology management. Welcome, John. He currently chairs and has done for over 10 years the EBME Expo. He's also had over 300 articles published, and he's an executive advisor to MTS Health, who are a leading partner and provider of clinical technology management services to the NHS and the private sector. John, if we could start off, please, explain to us a little bit about what clinical technology management means.
Clinical technology management means a lot of different things to different people, but to me, it means, simply put, how to buy equipment, how to use equipment, and how to maintain equipment, and how that is wrapped up in a regulatory framework.
Explain why then clinical technology and the management of those assets is so important for a trust.
It's really important because the good management of healthcare technology impacts directly on clinical care.
Just give me a feel then for the different types of assets and equipment we're talking about, presumably from the very small to the very large.
Yes, it can be anything from a small device like an infusion pump to large devices such as magnetic resonance images. It's not just things that you can see and pick up as well, it's also the actual software. It's a complex area in terms of how you define technology. I think one of the most important things is to understand that you need to use expertise to enable you to strategically align the clinical practices with the technology. And in that way, you deliver greater efficiencies.
Talk me through some of the challenges that hospitals are experiencing at the moment in terms of managing their clinical technology. Because I know from having spent time in the NHS myself, for senior executives to have peace of mind is really important.
I think there are probably two lots of challenges. One is workforce. In terms of the maintenance side, 90% of the staff are in-house in terms of the NHS. For the smaller devices, and the larger devices like the MRIs and imaging equipment tend to be outsourced to the original equipment manufacturers or third-party suppliers. So the challenges of workforce in terms of ageing, although 90% of those staff are delivering services, I would say probably 75% of them are over the age of 50. And that is a huge problem. And I think one of the initiatives that is really important is around apprenticeships and bringing in graduates so that they have access to understanding how to actually manage devices and maintain devices and deliver user training, but also the coordination of user training, a really important factor. There's been a lot of research around incidents, and user training has been found to be a big factor in terms of when there is an incident with a medical device, what is the cause? And I'd say 98% of the cause is around the use, not around the maintenance. So the maintenance is obviously very good on the whole, but the use is not so good. And again, I think that also can tie back into procurement. So that those are sorts of the management challenges. Procurement is really at the centre. If you haven't got the funds to buy the technology and the services that you need and the expertise, then you won't be able to deliver your strategic plans.
And are there certain benefits that a hospital would get from working with a third-party provider like MTS?
MTS Health has a lot of expertise, but also they have a wide range of staff who have hundreds of years of experience at managing equipment. That includes buying equipment, maintaining equipment. They've got a really, really good team at MTS Health to help deliver better strategic outcomes for organisations. One of the other things I wanted to mention around third-party providers, especially with regard to MTS Health, is MTS Health have a lot of expertise in procurement and procurement planning. Equipment replacement planning is something that's not usually done very well in the NHS or the private sector. And if you want to have a strategic plan, it's got to include technology. Over the last 15, 20 years, I know that MTS has been involved in multiple procurement projects, new hospital builds and new cancer centre builds, and have purchased over £1 billion worth of equipment.
And presumably, John, as well as new hospital programmes where there is a need for assessing the requirements for clinical technology up front, there is also an option to work with third parties like MTS Health on an advisory basis as well as a managed service basis.
Yeah, absolutely. It can start off from simply as helping them to develop a strategic plan. Right. One of the things that I've been working with MTS on is the Compliance Assure toolkit, which looks at the regulations and funnels them down into a series of compliance tests. And we send in experts into NHS trusts, and we've done many now, to see how they're meeting the regulations. But by doing that, we also understand where they can make efficiencies and how they can improve. And then we help them to then tie those audits into their strategic vision.
And when you engage with a hospital, who tends to own clinical technology? Is it the clinicians or is it the Director of Estates and Facilities or medical directors? Who's involved in that?
With regard to NHS trusts, although the guidance is there or the regulations are there, it's often a ball that's placed in different seats. So it could be the Director of Nursing, it could be the Director of Estates, it could be the Medical Director, or it could be a middle manager. It could be a general manager rather than a director. But what the regulations state is that there should be an executive responsible for healthcare technology. And that is often not the case. And I've spoken to chief execs at a few different trusts who are unaware of that. And that is also an issue because it shows that in terms of the regulations, which have now been around since 2012, so that's 10 years, it's been a regulatory issue. Boards still do not understand that this is a regulatory issue, as well as a potential benefit to them if they get it right. And you generally find the ones that are getting it right are investing 4 to 5% of their budget in technology, and the ones that are getting it wrong are only investing 2%. So you can see a definite difference. And also one of the other things you can see is that the clinical decision making in the organisations that have the right technology is better throughput of patients within the organisation. So the efficiency of the organisation is absolutely impacted by their technology strategy.
Where do you see clinical technology management going in the future? What is the kind of next phase?
The next phase for clinical technologies is absolutely integration. It's already started, and what I mean by that is at the moment most hospitals tend to take data, write it down, look at the data and then decide what to do with the patient. There is already existing technology that allows you to not write the data down but to push the data into the electronic patient record, have the software look at the data and then give a clinical guidance, help with clinical decision making with the nurses and the doctors. It could be something like a score. A low score indicates the patient is not doing so well, a high score indicates that they're doing better, or it could be something else. So for instance, there are now software tools which can look at skin cancer and actually give a diagnosis which then needs to be checked by a dermatologist. If a dermatologist is questioning in his own mind, is that a melanoma or isn't it? And then he's got the reassurance that the software is helping him to make that decision, or her, then that's always an aid. The benefit of that also is that you end up making sure that patients are seen sooner, they leave hospital sooner, or they come back to hospital sooner. All of that technology and the use of that artificial intelligence is going to happen, is already happening, but it's definitely going to happen more in the future, where you push data into a system and it's not initially a doctor or a nurse that's looking at that data, it's software that's looking at the data, is coming up with a conclusion, and the doctor is looking at the conclusion and saying, yes, I agree with that.
John, thank you so much for your time today. It's been great to have you here. I think it's really kind of incumbent on organisations like Sodexo and like MTS Health to now more than ever work with particularly the NHS and the challenges that they are going through, the operational demand challenges, to see how we can improve and play our part in improving flow through the system, and you touched on how clinical technology can do that. So appreciate your time. Thank you very much.
Thank you.